With the end of the COVID-19 pandemic nowhere in sight, some are thinking that it would be best for the country to counter the virus through an idea called herd immunity. The catch? A medical expert we talked to says it's likely more fatalities and overwhelming hospitals with cases. Correspondent Megan Kamerick sat down with Dr. Stephen Bradfute to talk about the different arguments on herd immunity, as well as the potential long-term effects the virus could have on those who survive it, even without hospitalization.
Thank you for joining us, Dr. Bradfute. Could you explain what herd immunity is and what does it mean in terms of the COVID-19 pandemic? What doesn't it mean?
Right. So herd immunity is basically the what occurs when a significant amount of people have immunity against a pathogen. And that when you reach herd immunity, it really limits the ability of the pathogen, in this case, coronavirus, to spread from person to person. So if you have 50 people in a room and 30 of them have immunity against the virus, it's harder for the virus to jump because it has to jump through people that are immune to it and they won't be able to pass it on.
Do we know yet if we actually have the potential for herd immunity with COVID-19?
It's a great question, and it's an open question. Most people think that herd immunity for coronavirus that causes COVID-19 is about 40 to 60% of the population is immune to the virus. Some people have said they think maybe even 25% might be enough. Nobody really knows for sure, and it kind of depends on how fast this virus spreads, which is fairly well known, but there's still some questions about it. So some areas may be approaching that if they're very hard hit, but overall as a country, it's doubtful that we've approached that threshold yet.
You hear people saying sometimes it's, there's a lot of economic consequences to shutting down the economy for people's health. And people in frustration say, just keep it all open, we'll all get herd immunity. Can you address why that might be a mistaken idea of how herd immunity works?
Right. Well, so a lot of it is based on your perspective. It's easy to say that when you haven't seen patients dying in the hospital. On the other hand, it's easy to say stay at home when you have a job. When you have something you've worked all your life and you've lost it and you'll never get it back, and you have someone that's making good money and their job is perfectly stable, they're not going to understand where you're coming from. On the flip side, if you're not working around patients that are very sick and dying of the disease, it's hard to have that perspective as well, that this is really a big thing. So I think people have to, and I know it's not the easiest time in our lives to do this, but I think people have to understand and respect other people's sides and put yourself in their shoes. It's old advice, but it's really good advice, because I think often the answer is somewhere in the middle. The whole goal of limiting and flattening the curve, limiting the spread, is because if everybody gets infected very rapidly, our healthcare system is going to have a hard time dealing with that, and a lot more people would die in a short amount of time. Flattening the curve, it doesn't mean that fewer people are going to be infected. It means that the amount of people infected will spread out over time, so our healthcare facilities can handle that. The downside of that is it might lead to the virus being around a little longer so that it can kind of come back, but it doesn't overwhelm our healthcare system either. So I think I understand both sides because I've seen both sides. But the idea for the herd immunity is that you're going to have a lot of people get infected, and we don't know how well people are going to have immunity after that. And a lot of people will have to get infected for herd immunity to work. And there are some consequences to that. And a lot of people are going to get really, really sick. And a lot of people are going to die because it would overwhelm our healthcare facilities.
Forgive me, you might have answered this, but how many people would need to be infected before herd immunity kicks in, or does that vary with the illness?
Yeah, it varies with the illness. The best guess is 40 to 60% for this virus. For something like measles, which is spread like wildfire, you need as high as 95% of the population. But most people are guessing between 40 and 60%, either with infection and that leads to immunity, or with a vaccine that would provide immunity.
Some of those who buy into the idea of herd immunity think they're fine not wearing a mask because the majority of others are. Could you address that?
Yeah, so masks are, not all masks are created equal. There's three main types. There's the N95 mask, which is made to work extremely well at blocking transmission of any airborne or droplet pathogen and blocking it from coming to you. But those are largely used by healthcare workers because there was a shortage for a while, and so people were asked not to wear them so that healthcare providers could have them protect themselves. Then there's the surgical mask that you see that surgeons often will use, and they're kind of made to block people that are infected and don't know it, or infected and do know it, from spreading it to others. And so they work pretty well for that. How well they work at stopping you from getting infected from somebody else, I think, is still up in the air. And then the cloth masks, which historically have not been recommended for use, but now they are, and there's studies ongoing about whether or not, how much, how protective this is. But the general idea is the more precautions you take, the better off you are. So if one person's wearing a mask and one isn't, that's better than neither person wearing a mask. But if they're both wearing a mask, that's something that people can do to try to reduce the spread. I think there's been some confusion, and understandably so, about mask wearing, because originally people were told not to wear masks, and now people are told to wear masks. And I think the bottom line is that it does provide some protection, and everything that we can do, I think, to stop the spread is something that we should be doing.
In New Mexico, Governor Michelle Lujan Grisham told the Washington Post this week the estimates are that maybe 50 to 55%, and that's well short of the 80% she called important, are wearing masks. So why is that a key figure?
Well, I think it's just another, and I haven't seen the data behind that, but it's just basically there comes a point where, if it's kind of like herd immunity, if you reach a threshold where enough limitation of the spread is going on, then the virus stops infecting as many people. So there's what's called, so if you get like an R naught is the number that's thrown around of 2, that means for every person that's infected, they infect 2 other people. So by social distancing or having herd immunity or wearing masks, is you can drop that number from to less than 1. That means for every person that gets infected, they will on average infect less than 1 person, and then the virus spread goes down. So I think that's the reasoning behind those numbers.
And across the country, many of the new cases, roughly 45% here in New Mexico, are people aged 20 to 39. COVID is less likely to be fatal for them. But what are we learning about those who contract it and survive?
Yeah, it's a great question. There is some literature coming out. Unfortunately, a lot of it's publication by the press. And that means that someone finds something and it gets published in the press, but it doesn't undergo scientific peer review. So I'm a little more cautious about answering some of these questions until it's gone through the standard scientific process. But having looked through the literature that's available and analyzing different studies that are out there, there is a significant proportion of people that get COVID-19 that have long-term effects that can last months. And of course, we're not that far into it, so we don't know how long it can be. Some people have complained of having still, shortness of breath, difficulty exercising, even after they've cleared infection. Some people have reported having neurological symptoms, kind of a brain fog, or difficulty doing some tasks they normally didn't have difficulty doing. There is people sometimes will get blood clots when they have infection and they're in the hospital, and that can lead to tissue damage that can be kind of residual. There's a couple of groups that are working, several groups that are starting to track patients long-term and seeing what those effects are. There's actually an app that some people can sign up for and daily report their symptoms. How am I feeling? How long has it been after infection? So that
yes, I do one of those for Stanford.
Yep, exactly. And it's a great way of looking at it. Right now, it's not clear if, there's obviously you're worried about people that have been in the ICU. There's also psychological things that can happen. I mean, just being in the ICU or being ventilated normally can lead to issues because of, just the trauma of it all. But also, these days, you can't have a lot of visitors, right? You don't see everyone that comes in to see you is, completely gowned up and masked up. And so there's some effects of that as well. The percentage of people that have these long-term symptoms, it's still unknown. I've seen estimates as low as 10% of everyone that gets infected, maybe over half that go into the hospital have some effects that last longer than a month. But it's really an open question at this point. But there are some concerns about longer-term symptoms even after clearing the initial infection.
If younger people aren't as serious about COVID-19 transmission, what's the implication for the rest of the community?
Well, I mean, it's the whole goal is to try to keep the virus away from those that are most at risk, and that tends to be people with underlying conditions and the elderly. But it can cause disease in people that are a severe disease in people that are otherwise, they're healthy, and so it's one of those things where you try to take as many precautions as you can, and go from there. Some people are. That have underlying conditions will be fine. Some people that don't have underlying conditions will have severe disease. But overall, it tends to be the elderly and those with underlying conditions. And so the concern is you don't want to even if you're healthy, you don't want to get it and pass it on to somebody else. And you can probably pass on the disease even before you have symptoms in some cases, or even if you don't have any symptoms throughout the course, you might unknowingly pass it on to someone else. So that's the concern.
Well, Dr. Bradfute, thank you so much for speaking with us today.
No problem. Thanks for having me.